Okay, so we're starting your procedure here, and I want to show you a few things. All this red stuff is synovitis, okay? This is the inflammation inside the joint. This is very red, very inflamed, which is probably causing a lot of your issue. So we're going to start by removing all the synovial tissue. The downside of this is it can swell a fair amount. I don't recall that you had a lot of swelling the last go around, but you might or could have this go around. So we're going to start with that, clean that up. It goes all the way up. I'm going to go up under your kneecap here, up under here as well. See all that red stuff there? All right, so we're going to clean that up and then go ahead and look at the rest of your knee, and I'll be right back with you. Okay, so we're back on, and this is going to be kind of deja vu all over again for you, I think. So I want to show you this again. This is the meniscus, okay? And it doesn't look that hateful. What does look hateful is what's below here. This is the articular cartilage of the tibia. It starts normally here and then just starts to thin out and wear away where there's really none right there. All right. I know we've had a lot of discussion in the other knee about all this, but this is the reality check, kind of. This is the normal cartilage, and on the femoral condyle, this is abnormal cartilage. So we can smooth this out, but it doesn't make it go away, and this is going to bug you, okay? So when we see at the 6-week point, and you're saying you still have some soreness in your knee, it's going to be this stuff, okay? I can get a glimpse in the back of the meniscus here. It looks like there is a tear there as we expected, but I want to see it better. So let me clear that up a little bit. Let's see if we can get underneath there a minute. And this is always the dilemma in the arthritic knee, is which of these problems is the issue. And I'm going to tell you from years of doing this, the arthritis piece is an issue. Okay, there's a little tear right back there. I don't need the punches. So we're going to trim that up a little bit, clean this up, try to smooth this out a little bit, try to buy you some time here, okay? So the arthritis discussion is the same as it's always been, so I'm going to give you the kind of the short bridge lecture portion of arthritic knee treatment that's non-surgical. Surgical treatment for knee arthritis is knee replacement. Right now you're a little young and a little big to consider that. We put our pump up to 60 a minute. Okay, so that's number one. Number two is get smaller, stay smaller. Okay, take the load off of here the best you can. I know that's easy to say and hard to do, but the science supports that. Over-the-counter medications, Tylenol, Advil, occasional, and I mean really occasional cortisone injections, and then gel shots, and then you're starting to talk about knee replacement stuff, okay? So that's what this arthritis piece is starting to kind of behave like. All right, so we can get back in there. There's that little tear in the back. We need a 50. Yep. I'm just trying to get our water flowing here so we don't get so cloudy here. Okay, so I would bet, and you may have to go compare the DVDs because we don't keep a copy for ourselves, we just give them to you, and see if this isn't exactly the same as your other side. I bet you're going to probably see the same thing, and we probably had the same or similar discussion. We'll take the Arthro one here. Now we haven't looked in the lateral side yet, or the outside part of your knee. We'll go look there in just a second. I'm going to trim this back. Get that out. Oh. And all this here is arthritis. Okay, it's a pretty big expansile lesion. You see loose pieces here. We're going to take those back and try to get them back to stable tissue. But we can't repair that hole. Okay, that's the problem, and that's pretty big. That's the entire medial condyle there. Okay, shaver, and that's the arthritis piece of this. Okay, so the reason we're here is you kind of convinced us the other knee got you some better. This should improve you a little, but it's certainly not going to make this all go away. So we're going to be talking about arthritis for a while. The old shaver minute. So sometimes we talk about knowledge is valuable, so knowing what you have helps. So hopefully that's, if there's value out of this case, it's saying, okay, I got to see what I'm dealing with here. So far, the rest of your knee looks pretty good. Okay, now we're going to look into the outside part and see what's over there before I majorly look bad here. There's a little bit of a fissure on the lateral side right there, but nothing that looks totally hateful, but this side looks pretty good. So if you compare the two sides, except for that one little small defect right there, this side is pretty normal, okay? Again, most of your stuff is on the inside where you're hurting. That's the typical place for guys to wear out. They can go. And this is all that synovitis again, so we're going to continue to work on that, clean up all this red stuff, and then get you out of here. Okay, so your post-op instructions are the same as before. Take it easy till we see you back. We'll get some therapy set up, okay, when we see you back next week. But I hope this is giving you a pretty good visual. I like the tapes because they're real. It's not me drawing you a picture. And then you can see where this stuff's rubbing a little bit right there. Probably causing a little wear on the this is the outside part up by the kneecap area. In case you're wondering where we're at, but it's a lot of synovitis here. It's just the body's response to problems in the knee. It gets angry. It's like the eye tearing up. All right, well, I'm going to cut off your tape here because we're about done. We will see you next week. Take it easy till we see you. Okay? Over and out.